The Department of Basic Education says it's working with various organizations and experts to provide psychological and, services in psychosocial services, I should say, in schools. I imagine psychological as well. This follows a huge demand from teachers to help them cope with COVID-19 related stress. The department has extended the services to both educators and learners, as many have either lost loved ones or recovered from the virus. To help unpack the impact of COVID-19 on mental health, we're joined by Mandy Rodrigues, who is a clinical psychologist. Mandy, good to have you. Welcome to the program.
Thank you, Leah, and good to be here.
You know, this term COVID trauma, it's becoming more common since, obviously the outbreak of COVID, more so because experts such as yourself are seeing more of this in your profession. Perhaps you can tell us exactly what it is and how prevalent or widespread it is.
So I must say, there's this new concept called COVID burnout, and every single patient from expectant mothers all the way to my babies, to mothers giving birth, to school kids and beyond, the stress, every session somebody brings up COVID-related stress. You know, this has become something that the whole world has been exposed to, and it's touched every single one of us. It's not something remote where there's a war in Syria or a World Trade Center event that we're not directly impacted on. And I think when this first happened, we thought it would be short-lived. So we all reacted with adrenaline and we kind of coped. And I'll never forget when that second lockdown was announced after 3 weeks. People started becoming chronically stressed, and it is just, we're seeing no end to this. So it's something that's very real and has created this post-traumatic stress amongst everyone I see, from the babies all the way up.
It's fascinating that you say from babies. I'm going to start there and stop you there, because what kind of things do you see in babies? I mean, one would think, yeah, as long as they've got their parents, they're okay. But then again, maybe I'm going to answer the question myself. They pick it up from their parents. Or, talk to us about actual babies going through this.
I think it's actually more than that. So if you think about it, babies, they usually have a couple of caregivers or extended family members. Now they're kind of limited to their mother and maybe their father who's working at home. First of all, everyone often has masks on. So when they are exposed to a doctor's room or to people on TV, there's masks. And babies learn speech and facial expressions by watching people's mouths move. That's how you develop your speech, is you watch the mouths, you watch the expressions. So first of all, we're seeing speech delays. Secondly, we're seeing huge separation anxiety, more so than ever before. So this is even more compounded in these babies. They're not going to the usual mums and tots groups. They're not going to play schools. And it's sad. There's a video gone viral where little toddlers of 13 months are trying to wash their hands on anything they can see. They're not getting physical contact from others. So I look at my little nieces who, they asked my mother for a back hug. They happen to live with her, and they are so indoctrinated by the fact that they can't touch anyone, that all they're asking for, they're craving, just let our backs touch so we can have a hug. And I think it's having a huge impact on developmental delays in babies, going on then to preschoolers and definitely the teenagers.
This is, these are all things we perhaps take for granted because, you and I were, I suppose, brought up in a very different world to what the little ones are going through at the moment. But I suppose kids adapt quite quickly, and, we're seeing things developing, albeit very slowly, with regard to a vaccine, and we're hoping that, there will be at least, we're hoping that, there'll be this Johnson & Johnson vaccine that is going to touch down this week, and we'll start rolling it out and see more and more and more people getting this, and some light at the end of the tunnel. At the moment, that light is very, very dim. In fact, it's hard to see. But as soon as we start getting a little bit of normalcy back, or what we believe to be normalcy in terms of the touch, in terms of babies being able to do what we remember, will this help them, or is it something that could be a long-term scar? What do you believe?
I think it's going to be a long-term scar. I think even if we look at research on the second generation of Holocaust survivors, these are people of Jewish descent born in South Africa. They are still traumatized by what their grandparents went through and the visuals that they've been exposed to. And I think for a long time coming, we're going to get used to this new norm. And I already, with myself, we used to do the elbow greeting with patients or with business colleagues. Even now, I haven't, other than my husband, but I haven't kissed anyone on the cheek or shaken their hand. And for me, that's going to take a huge adjustment. You can imagine for children now. They've been raised with this sanitize and stay away from people and don't go too near them. And I think for a long time, there's going to be this trauma and uncertainty. And with social media at the moment, we're exposed to our parents playing the news all the time and hearing about herd immunity, and this is not possible anymore, and this is not what we're aiming for, and the virus is mutating. And I think it is so important to limit that social media for our children now. Initially, it was something I was very firm about with children, and I made a couple of videos that their parents should switch the news off. They should establish other routines, other kind of adjustments. I'm seeing small kids whose parents said they would never have a cell phone, ever, or until they were at least in high school. That has changed because social interaction for kids has now become online. They're more exposed to, I'm seeing online bullying. I'm seeing with TikTok, there's quite a few inappropriate things going around on TikTok. But unfortunately, we sit and we can either put our children in a little corner and deprive them completely of social interaction, or allow them certain interaction, which unfortunately has been virtual now and has been on Zoom. I'm seeing kids presenting with headaches. My son comes home with a headache every day because he sits in the classroom not moving with a mask, and that breathing eventually becomes quite laborious for them at the end of the day.
It really is.
So I think for a long time to come, we're going to be afraid, and we're going to remain afraid for quite a long time.
I think so. This is something that it's almost become second nature to us. But, it's a pandemic that we're living through. So obviously the repercussions are far and wide. And it's not only just from the fear of getting coronavirus. It's also been watching people suffer around. And like you say, there have been a lot of people that have lost loved ones. They've lost parents, grandparents, even children. It's been devastating. The stories that have come out, which we are still yet to deal with because we're still in the middle of it, and that's going to come out soon. But the department has seen a need to avail services, I imagine, of psychologists to help support those who need psychological help. And what I find quite interesting is that, the teachers have now had to adapt to becoming psychologists in a way. I've got a lot of friends that are teachers, and they are saying that it's not only the children they have to help. There have been many times that they've had to sit with the parents and actually almost counsel the parents, and they're not trained for this. And that's the reality. So talk to us about the psychology that's going on behind the scenes and how important it is if the department do bring in experts such as yourself to try and assist?
So I was thinking about that because I know Netcare has brought in a kind of you might say it's a lifeline where patients who are now admitted with COVID at least have a call center and get updates every day and make use of this call center and ask questions. And I think for the education department to put something out like that, where there's a call center available, firstly, to debrief teachers. I mean, teachers are having to use modules they've never learned before. They are having to work 24/7 to adapt to virtual teaching if they even have the resources. They're losing colleagues. There's job uncertainty. Schools are closing. People are sending their kids to online platforms and distance learning. And I think, so teachers, first of all, are burnt out. So they need support, definitely. The children need to speak about it. They need to actually, a technique we call flooding, where you talk about those fears and anxieties and you can reframe them in some way and say, well, what have we learned out of this? I take some of the children I see and I say to them, well, you're spending more time with mommy and daddy, but mom's become the ogre as well because she's become the teacher. Teachers are struggling because they're getting grade 2 or 3 pupils who don't know how to read. So these poor teachers are having to catch up grade 1 and grade 2 curricula on a grade 3 pupil, not knowing when there's going to be another lockdown. And then parents are struggling. You're having to juggle your work because of the economic insecurity, and you want your kid to pass, and you want them to get through, but it's hard enough for someone to study through UNISA. Now make a child try and study without possibly a caregiver at home without the resources. They definitely need some sort of, like I would say, a lifeline call center where they can phone and maybe be referred to the appropriate person or have counselors 24/7 available if possible.
It is something that, one definitely needs to bring into a school to help and assist learners, teachers, and parents alike. I mean, because that is, that's something that's so important. We've spoken about babies, we've spoken about children. I want to spend a little bit of time talking about the teenagers and those perhaps that are in the matric year and also the university students, because this has also been a very difficult time for them. I mean, I remember my university years very, very fondly. Time spent with friends, time going out, learning things, perhaps learning things I shouldn't have learned, but that was all part of the growing process. And these are moments that you can't relive. Yeah. And however, we found that this has been snatched overnight from these young adults, and it's also been a very difficult time for them. For an older teenager, young adult, what is the effect that this is having on them?
Well, I think it's impacting on their socialization greatly. I mean, it's a rite of passage to have, almost a rite of passage to have a matric farewell and a rage and a matric back, which are now super spreader, events. It's kind of a rite of passage when you're 18 or even before, you're experimenting with going out, you're having some alcohol, you've got your parents who are arguing with the curfew, but now it's punishable by law. So we've got this whole generation of teenagers who looked forward to writing matric, to having their matric dances, to having the university options open to them, and all of this has been shut down. So I anticipate that we're going to have some rebellion, when these curfews are opened, possibly, because this is now imposed by law. But as soon as these rites of passage are allowed, I think kids are going to really make use of it and rebel maybe more than they would have. We're already seeing an increase in alcohol and drug abuse amongst teenagers at an even younger age than what we've ever seen before. So it is happening, but it's happening kind of hidden and inappropriately, whereas it would have been a normal part of experimentation going into university.
Sure. It is tough. It really, really is tough. But I don't want it all to be on a negative note. As we end off this interview, I mean, are there positives? Because, I mean, I can certainly see, I have kids of my own, and I look at myself, and that there have been one or two positives that have come out of this. Perhaps starting things that they would never have done before, whether it be a musical instrument, whether it be some kind of a hobby that, you know, normally because you were out so much and doing physical activities and participating in all of that, you're not doing anymore. You've had to find other things to do. You know, have there been some positives to come out of this?
They have. I've noticed that, firstly, the relationships between fathers and kids has actually improved because during hard lockdown and even now, a lot of the dads still work from home and the moms. So we've got better, probably primary attachments, making separation anxiety a little bit more, but that stability for the younger kids. For the older ones, I'm seeing family traditions that have been lost along the way come back. You know, I look at my parents who live with my sister and my nieces and nephew, and they now eat dinner together every night, and they have a gratitude they say every day. And even if the little one says, well, we didn't die from COVID today, or no one got infected, or thank you for my family, they're looking at the simpler things. It's no longer about this huge Easter function or birthday gifts anymore, but it's going on a walk as a family. It is going somewhere without the alcohol, without your parents having to get a babysitter. Families are spending more time together.
Yeah.
And I find that is a good benefit that we're having. And kids are learning actually and more responsible, whereas we don't have those resources. So they're doing a bit more chores around the house, I've noticed. And they are learning to manage their time, you know, and maybe as a parent, I know with my younger child, I'm kind of, you know, you study for your exams. The teacher is going to let me know, or the school's going to let me know if you're not fulfilling what you should. Whereas with my older kids, I had sat down and studied for every exam. And I see this little one who's now in high school gaining far more independence than what he ever had, what my other kids ever had before.
Listen, fascinating discussion. I mean, it's things that we're all seeing and living, and there's just so much we haven't even touched on. And, you know, this list is endless. But like I say, we're still living through this. There's still so much we're going to go through and assess once it's done. Because the good news is, however long it'll take, it will be done one day. It will. Clinical Psychologist Mandy Rodrigues, thanks so much for talking to us about COVID-19 trauma, how it affects those who have had it, those that have lost loved ones, and most importantly, the effect on younger people and, I mean, even babies, and how they've been handling and affected by this.